It turns out it's National Beer Day.
Is it really?
Yeah, did you know that?
It was also National Cheese Day this week, I believe.
It should be on the same day, right?
National Donut Day, my personal favorite, is coming up.
I think the problem with those is they're a little too close together because...
Are they?
I just think...
I don't have a problem with cheese, beer, and donuts.
On the same day?
Yeah.
I don't know, man. That seems like a lot.
It's like breakfast, lunch, and dinner.
Oh, that's what it... Yeah, that's right. Yeah. That's all the balanced meals in a healthy diet.
That's right.
I love that. So let's do that. From now on, we're going to celebrate National Beer, Cheese, and Donut Day. And we're just going to add a little cronut to that, too.
That'd be great.
Here's the thing about our guest tonight, which is, and I have to say this, she's both our first guest who's won a Pulitzer, but possibly more important, she's our first guest that's ever actually also been a Daily Show guest during the Jon Stewart era. And so it's a little...
This is way bigger of an honor. Come on, guys. I mean, this is what I've been waiting all my life.
This is
Butter
really
us up, Sheri, please.
A career-defining moment right here, this
I'm
podcast.
Nervous, frankly. I hope that the listeners will... cut us some slack because this is nerve-wracking being here with you experts.
And it's also the first time we've had an in-person guest.
Is it really? In like 30 episodes?
Wait, you made me feel like I had to come all the way out here to Brooklyn.
That's it. We're really good at peer pressure.
Oh, that's right.
We try and get people to my dining.
What? I could have phoned this in?
Like every other guest
Only
does.
physically, not metaphorically. Well, if Mark Maron can do this in his garage, I feel like my dining room table is a totally appropriate place for all manner of guests. Yeah.
So maybe we should introduce our guest.
Oh, yeah. We're doing this a little backwards. See, we're already starting out and we're doing it in the wrong order. Sheri Fink, ladies and gentlemen. I'm going to just give a couple of bullet points. I think, many people know Sheri from her Pulitzer-prize winning reporting that led to 5 Days at Memorial, which is her classic study of hospital evacuation and care after Katrina. Since then, she's a staff writer at the New York Times, where she won another Pulitzer, a team Pulitzer, for the reporting of the Ebola virus epidemic. Since then, she's done distinguished reporting about, honestly, too many disaster topics to cover in one episode. And so I'm just going to give sort of a reverse lightning round, because not only is it coastal storm scenarios, active shooter scenarios that we're going to talk about, but also things like ethically choosing who dies in a pandemic, the psychiatric care at Guantanamo, that story about Stephen Paddock's brain. I mean, those are things that you're like, it's a whole catalog of all of the worst things, basically, or what
you kind of sound like Stefan describing the hottest nightclub in New York
Hottest
City.
nightclub.
Ebola, Stephen Paddock's brain.
It's a strange, unique beat in journalism.
That's right.
The Fink Club. I like that.
Yeah.
It may be the hottest new club in New York City. So congratulations. So welcome.
Thank you for being here.
Thank you for inviting me. And hi, everybody out there.
In Radioland. I'm curious, Sheri, how did you originally get attracted to disaster stories and emergency management as a subject?
Well, I was going through med school, actually, and developed an interest in the wars that were going on in the former Yugoslavia. And that was kind of an extracurricular interest, had nothing to do with med school originally. But
that's the first sign, that
right.
Something may be wrong with your psychology.
Thank you. Thanks, Mitch. I came on here to be beaten
Mitch
up.
Starting off strong with
analyzed.
Our guests.
Well, only because I think you share that with all of our listeners. So it's a community of that.
Yeah. So, anyways, I'll try to make a long story a bit shorter. So, developed that extracurricular interest, and I took a year off between med school and residency, which I'm still on many decades later, but basically to go to the Balkans and understand how medicine was practiced in wartime, because through the early technology of email back in those days, I had made contact with some of the practitioners who were responding to that war, and in particular, these were med students who were doing war surgery, and it just seemed, and then there were all these really dilemmas for humanitarian aid. If you remember in the Balkans, so many parallels to Syria, what's happening today with utter violation of medical neutrality, attacks on medical, installations and hospitals and doctors and aid workers. And then, the international community at that point was saying we can't get involved because there's all these aid workers on the ground, so we can't get militarily involved. And it just went on, not as long as Syria. But so I, through email, met some of the people who were doing this heroic work and thought that there was something there that we here could learn from that. And that's how it all started. I took this year off. 1 year became 2 years. The war in Kosovo broke out, and I ended up doing humanitarian aid work just because I happened to be in the Balkans, and started, triaging outside of a medical aid tent when all these refugees came. That was my first kind of foray into it.
And out of that came War Hospital, right? Which is your first book, which maybe some of our listeners haven't read, but which is a fascinating, really inside account of that sort of treatment and scenario. And it's really still relevant today. I mean,
Thank you for the plug, Mitch.
That's right. It's like whiplash. We're going to be harsh. We're going to plug your stuff. It's just back and forth.
I agree. I think it is sadly still a very relevant book. It's sort of the story of the Bosnian War through the eyes of healthcare professionals, emergency responders in a way, who were literally under siege for 3 years and had to find a way to support a population initially with no aid from outside. They were completely cut off in Srebrenica. And then they got Doctors Without Borders came in. They had their own issues and complications. And then ultimately there was this genocide in this town. And so I used sort of the medical experience and the patients to tell the story of the larger war. And then I was just hooked. Basically, never really quite went back into medical practice. I did some aid work along the way of writing that book, which ended up taking 5 years. So it wasn't 1 year, and was writing more and more along the way, and really then committed to journalism ultimately, but stuck with writing about disasters and conflicts. And here we are today.
Wow. And now you're doing a podcast.
Yeah.
All the way to Dukes.
And I have arrived tonight.
Right. And I think we have so much to talk about, and so we have to sort of fast forward all the way to the historic, record-breaking scene from last year.
Right.
So much history, so much has changed, but so much, still the same, right? Some of the issues really are still relevant. And I guess, what we want to do is just tell a couple of stories from last year that you sort of reported on. And so taking it chronologically, Harvey comes in, hits Texas, massive unanticipated floods that came in that were historic. And you wrote about the evacuation of Baptist Beaumont in particular. So, looking at that, you've seen a number of healthcare evacuation scenarios, right? Katrina, Sandy, others. Can you just talk a little bit about how that one went? How it proceeded, if the hospital was ready for it, how the patients were moved, that kind of stuff?
Yeah, I think I'd like to almost take that more broadly, because what was interesting about the hospital situation for me was this question of how would they compare with Allison? If you remember Tropical Storm Allison in 2001, when the entire Texas Medical Center was flooded, or most of it, and put out of service. And so Houston, it's kind of, for anybody who hasn't been there, it's pretty unique in that all of their major hospitals are in one geographic area, because it was some land was donated for these hospitals, so they're literally right next to each other, and it's massive. They call it the medical city. Mm-hmm. It's huge. And so the question being, was something learned? Would it flood again? Would it fail catastrophically? Would all the patients have to be moved? Could patients get there? And so that was one thing I looked at, and didn't end up writing too much about it. It ended up working pretty well. Mm-hmm. I may still write about. I did spend some time in one of the hospitals there, and was really impressed by their their response. This was Houston Methodist.
Yeah.
And it was really, really interesting to see the lessons learned and how that served them very well. And also just like the leadership was super committed to responding and prepared. So that was very nice to see. So in essence, they had invested a lot of money, the Texas Medical Center, in shoring up their flood protections. And so they didn't end up flooding. But what happened was that they became an island. So they were surrounded by flooding. So one thing that maybe hadn't been thought about so much was, well, how do we get people to you when you're okay? And which is great and important. They could serve their existing patients. But then there were a lot of issues because that storm sat in the area for so long, and it was very difficult to transport people by air for a while. There were tornadoes, there was still a lot of rain, and then of course the flooding around it. So when you talked about people who needed healthcare in the midst of that crisis, that was a problem. There were some hospitals that shut, that pre-evacuated. A lot of them just became inaccessible, and EMS had a really hard time. So I looked at a lot at that, like this was one big thing for me from Houston. I'd say like the biggest takeaway was when you have a city with thousands and thousands and thousands of people calling 911 because they're flooded. How does your system figure out who are the ones who really need help?
Yeah.
And there were some really tragic deaths that happened, unfortunately. So, and then, like you mentioned, the storm shifted. It moved away from Houston and east, and the flooding continued, and it just hit other areas. So that was very challenging, just when you're thinking of a response, statewide, regionally, federally, when it's shifting. And so where do you move your resources? Where do you need them? Can you anticipate? Can you predict? And there were hospitals that were also just like on a hospital level, right? Because if you think about planning and staffing up for a hurricane, but this was an event that played out over so many days after the hurricane. So you might have had your A team there for the hurricane. The hurricane doesn't really affect your area directly, but then 7 days later, you're getting huge flooding. And so there were issues with staffing. There were hospitals that, I think in that particular case you're talking about, if I remember correctly, they had to shut down and evacuate because their water supply wasn't secure. So it wasn't even flooding or power outage. It was actually clean water, which you realize is kind of becomes really, really important for a hospital. So, but Texas has something really pretty cool, which we were tracking with that particular story. They have these task forces around the state. They call them task forces. And so these are like EMS assets, if I'm remembering correctly. And so they have these buses that are ambulance buses, large capacity, spread out in different places in the state. And so a lot of them got put into action, moving large groups of patients. And it's really like ambulance level care in a bus.
Wow. And these are run by the state emergency management agency runs these, or are these FEMA task forces?
No, this is state.
Oh, wow.
Yeah, Texas. But I think if I remember correctly, it's federal funds definitely came into play, and as well as state. So I'd have to go back and look at the exact, but it's organized throughout the state. There's like EMTF, Emergency Medical Task Force 1, 2, 3, 4, 5, whatever. And so this AMBUS from another unaffected area, their staff, their bus came and helped all the way over, and I think it was Beaumont where that, and then they evacuated. By that point, the flooding was lower in Houston, and so they took those patients into that Texas Medical Center, into one of the hospitals there. Wow. But it was still complicated, even this they had a number of days. They had this as orderly as possible kind of plan and evacuation. But even so, patients arrived. There were issues with family not being able to find people, or they ended up being sent a different place than the family had originally known. We were invited because we got to know some of the patients on the bus itself. The photographer was with them for the whole ride. I was with them for the end of the ride. And so they let us come with them to their hospital rooms. And that was interesting because I witnessed just the confusion and the lack of medical records. Even in the best case scenario, you still have these issues crop up. So it's really, really important. Again, we talk about drilling and practicing,
right.
And you don't realize these things until you actually play them out in real time. Right. How will you get this information? How will you notify family members? How will you track all your patients?
Like even the water quality issue of the hospital. I'm sure that hospital goes through drills every year, hurricane drills. But until you actually go through that, you're not going to think way down the line, our water system to the hospital may be compromised.
Yeah. There's so many lessons just in that story. And this question of, I wanted to pick up on this question of like societal triage, when there's so many 911 calls coming in to an overloaded system, and then you don't have enough data to do that. I remember people were also, tragically, a lot of them, people were tweeting at the same time. There was just so much data coming in, and if only you could find a way to process that as a system, it might help you rank and allocate your resources to the right places.
Yeah, duh. I mean, I think that the civilians are way ahead of the official responders in this case, right? Because you had Houston, this was interesting, Harris County and Houston, I believe both, their official responders decided to invite the public to respond. Mm-hmm. So they literally made a decision and got on the TV and got on social media and said, we can't handle this ourselves. Come with your boats. And that was really a lesson from Katrina, in partly because the people from Western Louisiana with their flat-bottom boats did a lot of rescues. Exactly, the Cajun Navy. So they were all over social media and using mapping, and there were people far away who were setting up these systems really quickly. And I came across this information recently, like the Coast Guard kind of figured it out in process. So as the kind of disaster was unfolding, they hooked up with one of these citizen, like computer GPS gurus and created something on the fly. But everybody out there, all of you emergency nerds, this is where the public is now. So one of my conclusions just looking at that is like, that's got to be thought about. Because if you've got a little bit of battery left, you could tweet, you can post on Facebook. You can't necessarily sit on 911 waiting minute after minute for that to be picked up and then going through a long thing. I mean, maybe you can. And so, but we need to be aware of how communication is changing and be flexible. And that's hard, right? It takes resources, but for me, it was a big takeaway from Houston.
Just to move us kind of down the pike chronologically. So, and it's just this long march. So then Irma comes. And, I think one of the stories that we wanted to pick up on, because it was such a story, was the story of the Hollywood nursing home and what happened. I wonder if you could just kind of give us a little bit of a play-by-play from that, because obviously we were talking about a success story in Houston, and this was anything but that.
Sure. So, so imagine like the New York Times has sent this huge cadre of reporters and photographers and videographers and podcast people and Hurricane Harvey, the biggest disaster that we can remember in a long, long time. And we're all there and we're just planning to stay there and all the lessons that we could take from this response. And then Irma. And I'm sure it's analogous for all of you responders, right? It was that same thing, especially on the federal level, right? It was like suddenly, okay, we all gotta, there's not an unlimited set of resources for all of this, right?
There's a lot of swear words. There's a lot of, fainting.
Yeah, so Irma smacks into the state. And I was tracking this as it was going along, because you had the entire state. So when you think about your nursing homes, your hospitals, and evacuations, and we always think about that question of, do you pre-evacuate when a storm is heading there, even though there's that margin of error, you you have to make the decision before you know for sure if you're getting that hurricane, because you need to move your patients before your general public. But then there's that whole other layer, and we learned so much in New York City with Sandy about this, but where do you move people and how do you keep track of them, move them back? But with Florida, it was just like the whole state was targeted. And that whole question of evacuation was a really tough one. So the vast majority were in place when the storm hit. And we know that we don't have such robust systems. Our infrastructure of our hospitals, and especially nursing homes and assisted living, it's just not hardened for disasters. Not a lot gets invested. If you remember we'll probably get to this later, but the Medicare rule was coming into effect,
right,
in November. So this was right before that.
Right there, right before, yeah.
Yeah. I mean, I guess officially it had come into play the previous year, but people had until November to get into alignment with that. And for listeners who might not know what that is, this was a lesson from Katrina. Our healthcare infrastructure is vulnerable to disasters. So could we, shockingly, there was no minimum standard for preparedness within many sectors of the healthcare system. A lot of hospitals had that because there were rules from the Joint Commission and other accrediting agencies, but nursing homes, assisted living, even home care agencies, because a lot of our very vulnerable people get served at home. Psychiatric hospitals, a whole range of providers didn't really have minimum standards. So it took many, many years to get this quote unquote unfunded mandate through the system. Right. And the result was, if you're a provider and you take Medicare funds, you have to now have some minimum standards for preparedness, including some kind of basic things around power and maintaining power and backup power in an emergency.
Right.
So what happened with Hollywood, this was a very long answer to the Hollywood Hills.
No, it's good. It's good.
Okay.
And we're going to tag back to the CMS stuff in a second. So,
okay.
Go forth.
Hollywood Hills was I think officially a rehab hospital, and sorry, he wasn't laughing because people died at this nursing home. He was laughing because they're opening their beers. I am not partaking. I just want all the listeners to know that.
That's good. She's the responsible one in this crew. And it's not a great. It wasn't great timing, really, on our part.
There's no good
story
time.
she's about to. In our podcast,
I hear
there's
that,
never a good time.
Traditionally in this podcast, at the most tragic moment is when the beers get opened, and that is how people get through disasters, right?
True.
We have to. Self-care,
absolutely,
right. And then of course it leads to long-term liver damage, but that's not, we don't have to worry about that now. We can worry about that in 10 years, 15 years. That's right. But Hollywood Hills,
nursing home, or officially I think a rehab hospital, and 2-story building, kind of old, had some issues with air conditioning over the years, but basically a horrific scenario played out, which is that, as you probably remember, there were widespread power outages in Florida after Irma. And for many, many, many days, hospitals and nursing homes were relying on backup power systems. And it just, if they were having problems with power, if they were having problems with fuel, if they had issues with air conditioning, there were a lot of communications going on. There was good communications. They could call, I think people did generally have access to, administrators had access to communications, but they would lodge or log their requests for assistance, but it just didn't get everywhere. And particularly with power restoration, this was interesting because the nursing home associations were telling the nursing home administrators, you are on the list for priority with the utilities, the electrical utilities, for restoration. So, i.e., if you think about, you're a power company and you think about what are you going to bring online first, there are certain key institutions like hospitals, and we thought nursing homes to come on board first. Well, it turned out that in some cases these utility companies didn't have the same idea that the health officials or the trade associations were telling their administrators. And so days were going by and power was still out for some of these many of these institutions. And so a couple days into this, maybe 3 days into it, there started to be calls to 911 from this one institution, and one after another, these seniors were being spirited off to a hospital that was right next door and did have working backup power. And they were coming in with temperatures that were sky high. I mean, insane temperatures, like 109, I think, was one. And so clearly hyperthermic. And they had, there's been an investigation, and ultimately a dozen deaths have been, now there's like, I think, investigations into like homicides allegedly, but a dozen deaths that the local medical examiner or coroner has said were related to the conditions at this nursing home, the extremely hot conditions. And they actually had power, interestingly, but their air conditioning system was on some other circuitry, and that had blown out and hadn't been restored. And they are required to keep their temperatures at 81 degrees or lower. And but they obviously it became much hotter, right. Allegedly, and there was a lot of criticism. It was a deeply horrific and embarrassing incident. And so the governor spoke out really forcefully. He pointed the finger at the nursing home. He said there was a working hospital right next door. Why didn't you move your patients? The nursing home has said that they did everything right and it wasn't that hot. And how the heck were they supposed to get an evacuation of their institution? They were told not to evacuate. I don't know, something. I can't remember all of their reasons, but
it's crazy. And so I didn't realize that point that they actually had power, but the air conditioner system was on a different network.
Right.
So even if they had a generator, coolers. They couldn't. It wouldn't have necessarily powered. The issue wasn't getting power to the building; it was that specific.
Yeah, and this is what's so interesting, because what's come out of this is a new regulation for all assisted living facilities, nursing homes, and assisted living facilities and nursing homes in Florida now have to comply with having generators for the nursing homes, or access to generators for the assisted living, and a certain amount of fuel present. But it is kind of interesting, because the actual case example that led to this outrage and led to these requirements, in fact, they were running these little spot coolers because they did have plugs that they could plug into. The latest in all of the, the legal cases and all of that, like the latest headline I read was that the way that the spot coolers were hooked up and the way they were vented may have made it actually hotter in certain parts of this facility.
Oh, God.
But and again, it's a lot about like leadership, and those of you listeners who have some capacity to lead in a disaster. I think when I interviewed, I spent a lot of time talking to like families who had been there and staff who had worked there, and they sort of felt like at night all the leaders went away and it was just kind of lightly staffed, or the evening staff, and it seems like it got really, really hot that night, and there was some sort of failure there that's still kind of mysterious, to not catch it in time, and then just one after the other these seniors died. And it really baffles me too, because I know I was calling administrators all over the state for days, and a lot of them were in this situation, and it's really, really weird that all these deaths occurred at this one place. Wow. And I even wonder, like, do we know where all the deaths were? Is it possible that there were other little pockets of people dying that just might not have been caught?
And that's a good segue to the Puerto Rico story in terms of Maria, because I think one thing, and I think New York City learned it after Sandy, was that there are different ways of counting deaths after a storm, right? There's kind of the the right out of the gate, it's this many people. It's usually a pretty low number that were directly killed by flooding, that were killed by storm surge. Maybe they, died of carbon monoxide poisoning because they didn't know how to use their generator, something like that. But then there's this idea of excess deaths or other ways
indirect
deaths.
Mm-hmm.
So can you talk about in terms of the Puerto Rico situation, what you guys found when you sort of looked into that question?
Yeah. So it is, what I've learned is that it's up to each local medical examiner or coroner to come up with their system for how they would count disaster deaths. And this is really important when we think nationally and we think about official tolls, that everybody's doing this differently. Interestingly, the CDC has released a document, and I think it was actually, if I look at the date, sort of like in the midst of the season or just after, that really advises, that provides some guidance to the local authorities that they do include these so-called indirect deaths.
Right.
And these would be deaths that, unlike the ones that you just mentioned, would be ones like somebody couldn't get to a hospital, or they didn't have access to their medicines because they were stuck. The storm hit and they were somewhere where they didn't have their insulin, or many, many things. We could think of destruction of healthcare infrastructure. We could think of, in the case of Puerto Rico, prolonged power outage. And so my colleagues and I, and in particular my colleague Frenchie Robles, really got onto this idea that the death toll just seemed, the official toll in Puerto Rico seemed kind of suspiciously low, just given the widespread devastation, prolonged power outage. And so we were able to get some statistics from the health department on deaths and pull in some people I knew who were statisticians to run the numbers. And indeed, the excess deaths, if you just take as a denominator, even though a lot of people left Puerto Rico after the storm, but we just assumed kind of like one population. So we're being conservative here, in other words. And you look at deaths in 2015 and 2016 in the same months, and then 2017, and we saw like statistically significant increases in mortality in a number of areas. I mean, overall, but also I'm trying to remember, we if you go to the story, there's some graphs, and we pulled out you could see like the most significant increases. If you have the story in front of you, Mitch, you can weigh in here. But it would be it was things that made a lot of sense. It was like the chronic diseases that get exacerbated, the vulnerable people who in a disaster tend to, as we know, be more vulnerable in a disaster as well. And so that was, our reporting and that of other media outlets also had this idea. Did you just pull up the story? It's you want to just weigh in here?
No, please. This is where
Mitch is waving his hands above his.
Yeah, that's right. It's like, me,
Sheri, pick me.
Oh my gosh. But no, I actually didn't have it in front of me, so we did all that just for naught.
But anyways, it's the things that you might think about, and it is important for those of you who are listening, who are public health officials or medical people, might want to have a look at what it is that people die of in excess when you have the kinds of conditions that we had and still have in Puerto Rico. So it actually led to a commitment by the authorities to really look into where these deaths were. And they I spent a lot of time with some of these officials. They actually, in Puerto Rico, their rule is to count these indirect deaths, but they were having a really hard time finding them.
Oh, wow.
And yeah,
I don't know that I knew that part. I could, because I think the way it got shortened, the way it got sort of tweeted, was that these guys were covering something up, but it was really like they had committed to doing it this way, but they just couldn't pull the right data sources. They couldn't access them. Is that what it was? It
was more that they were trying. They sort of kept saying to us, well, okay, and this was before we ran those numbers, and just when there would be these rumors that there were lots of people in morgues, and there had been these lots of deaths, and they weren't included in the numbers. And so the officials kept saying, well, show us the people, give us the cases, we'll investigate. And so they were almost saying, bring them to us. And I think that you can interpret it in different ways. Is it a cover-up? Should they, as public officials, be going out and case finding and trying to find the cases? Whose responsibility is it? I had their top emergency official just sat there for 2 hours telling me, it's my honor. I'm a straight shooter. I'm not covering anything up. I don't have any reason to. What would be my motivation? I'd get, there would be maybe more help if the toll was higher. But, other journalists really didn't really buy that and felt like there was an attempt to, at least in the early days, kind of obfuscate. But so whether it is intentional or whether it's disorganization or whether it is really hard without statistics to find those deaths in the midst of a catastrophe when public officials are trying to get help to the living, I guess. I don't know. It's
right.
still
like they were still in response mode, right? So maybe it was they weren't physically able to go out and find all the excess deaths.
Which you could imagine maybe in the really, really early phase.
Yeah.
But as the weeks and months go by, I think as a public health official, this was where I kind of was thinking, don't you want to know? Don't you want to be running these numbers? Don't you want to be kind of understanding what people are dying of and maybe trying to intervene and prevent those excess deaths?
Right.
And so I went and did a story that you can find about, I just looked at one Section 8 housing that had a lot of seniors and a lot of people with various disabilities, had been without city power for weeks and weeks and months at that point. I think it was in November. And I just looked at that one building and the people in that building. They did have generators, but they were only running them certain hours to save on fuel because they would break down. And this is one thing I always say, always, every disaster that I've reported on, these generators they're not like built to work for a long time. And if you expect them to, you're going to be, maybe disappointed. So, and so the people in that one building, they had some deaths there, but they also just had a lot of morbidity. So there were seniors that were falling because it was dark. And so there were more falls and breaking bones. There was one woman, the most dramatic story. It was dark at night and she grabbed a water bottle and it was crazy, right? She started to drink and it was bleach. It was, her daughter had given her some bleach to wash clothes in the sink, and she drank bleach in the middle of the night in the dark without any way to contact anybody for help. But she was okay. She was a very tough lady.
That was amazing.
She actually laughed about it.
And she had the presence of mind to drink. She drank condensed milk or something, right? That caused her to throw it up, and the doctor said that basically saved your life.
Something like that.
It's amazing.
Yeah.
So for the record, the kind of causes of death that we're talking about when you're talking about indirect death, there's things like sepsis and pneumonia, emphysema, diabetes, Alzheimer's or Parkinson's. These kinds of things that are chronic, but that spike after situations like this.
Well, in this particular, so that you were reading, that was our analysis of the data from Puerto Rico specifically.
Right.
Yeah.
And I think the thing I want to focus on is, the thing about the Hollywood Hills nursing home story, and we're kind of oohing and ahhing, and it's very sort of dramatic and tragic, was that, and I just did kind of a web analysis of stories of that story got so much attention, much more so than this Puerto Rico story, either the stuff about similar nursing home situations there, or this massive, to me as a disaster person, this 50-fold death increase is a massive story about the nature of disaster, and I'm shocked actually that it didn't get more play than it did in the aftermath of this.
Yeah, I totally agree with you. I think that's a question for journalism about disasters too, and about just for us to understand, why do some stories really resonate and others not? And I think a lot of people would say, well, Florida, seniors in Florida, just like sort of like the discrimination or the lack of interest in places where the language is different, or, that was a lot of what I heard when I was reporting, and just the sense that, people didn't care as much about Puerto Rico or the Virgin Islands. I don't know, but I can definitely say, we have access to metrics in our stories, and we can sort of see what takes off and what doesn't. And you're right.
I think
strange.
It could be because,
disappointing.
as New Yorkers, we all think we're going to retire to Florida one day. And so we were all like, that could be us.
As New Yorkers, we're all Puerto Ricans.
Yeah,
Come on.
That's the better story, right? That's the more true story.
Yeah, there's a huge population
so
and a huge relationship between New York City and Puerto Rico.
Yeah.
So what's the big takeaway? So one of our listeners, Dr. Samantha Montano, wrote in, to ask the question, well, has it improved? You've been following this for a long time. Allison 2001, the big story in Katrina 2005. It's been more than a decade than that. There are new CMS rules. Florida has new rules. Is it better? Is it improving? And if so, what's making it improve?
So I would say it's better in some ways, and there are always new challenges, and it's kind of like preparedness itself, right? You make your plan, but you got to exercise your plan. You can never stop. It's just preparedness is a continuous effort. And I think as society changes, as different storms hit, provide different challenges and hit different places and geographies and populations, we learn with every one. And there's just no such thing as perfect preparedness. And also it's just a lot always about this larger question of triage, which is when we have rare but foreseeable and potentially catastrophic events, how much do we as societies invest in realistically either, kind of girding ourselves and protecting against these hazards, or realistically preparing for responding to them and being resilient. And boy, I mean, we just over and over again, we don't make those investments and we don't prepare realistically. And it's hard for human minds to grasp worst case scenarios. And it is a legitimate public policy question. Where do you put your resources when you have all these everyday priorities? So sadly, we see this kind of horrific excess mortality in the wake of the storms that hit Puerto Rico. We see needless deaths. We see, failures. And then we see some lessons learned. We see the Texas Medical Center making those investments after Allison, then really serving them well for Harvey. So it's a mixed bag.
And you talked about the Medicaid Medicare rules, what we call the CMS rules, and you mentioned they're an unfunded mandate, which is, they are new rules kind of without new funding. But I think they come out of a long history. Do you think they'll be effective? I mean, do you think that it's a useful step for the industry to take?
What I sense, which is a vague thing, I can't put numbers on it, but I do sense that there is more of an awareness of the vulnerabilities that we have, particularly in our healthcare system when it comes to emergencies, a more of an awareness that these are important kind of societal institutions, even when they're privately owned, for example. Any of us could need a hospital or a healthcare facility of some sort in a disaster, or we'd have a loved one in one, whether it's a hurricane or a wildfire or a mass shooting. We want these institutions to be prepared, and we want the systems, the emergency medical systems, to be prepared. So I think what the CMS rule, what this Medicaid preparedness, emergency preparedness rule has done and is part of, is just kind of raising the profile that this is an important priority for society.
Yeah.
And sometimes it comes down to requirements and finances. And so now the government is saying you've got to do this. Unfortunately, if you look carefully at what's actually in those, it's a little bit weak. And, who knows if it will, how much of a difference it will make. And some of the more stringent requirements were taken out when there was every time there's a new rule like that, there's a period where the public can respond.
Yeah.
And the healthcare industry partners really pushed back on some of the proposed requirements, including around generator testing, interestingly, and just saying it wasn't cost effective, it wouldn't help really,
right,
and would cost a lot of money. And so it remains to be seen. I want to make a pitch for data collection, and for every time we go through one of these, we should be learning. And unfortunately, sometimes politics gets in the way, because it could be really embarrassing if a lot of people die in a disaster, and we don't always get good documentation and data out of these disasters that could help us prepare better or know what it is when you make an investment, whether or not it paid off. And I always ask that question. I always say, when I'm reporting, did any of the drills that you did before this help? Did any of the investments, the hospital preparedness funds or the CDC preparedness funds, did any of those serve you well? And the vast majority of time, people say yes, and they can give me specific examples. I could give you a kind of a heartwarming one if you want.
Yes,
sure.
we
We're a heartwarming show. We'll play some strings in the background.
Getting close, so
it's all right.
We want to uplift after all this heavy stuff.
Sure.
Well, okay. So you talked about my book 5 Days at Memorial, which was about one particular hospital where the shit hit the fan. Can I say that word on this podcast? Are you going to have to
never
bleep
sure.
I believe so. We haven't gotten any
We'll
letters
check
yet.
with the censors.
The S hit the fan in case you need to edit that out. Well, it was a horrific situation, and the hospital was surrounded by floodwaters and lost power. They had to make difficult decisions about triage when, one helicopter would come and then another, and very slowly, who do you take out first when you have a whole hospital full of people? And one of the big issues that I wrote about was that there was not good planning around what we call in medicine bariatric patients. These are, just human beings in our society who are really heavy, obese. And it's a big issue. A lot of people who are obese who end up in medical institutions like anywhere else. And there was just like no thinking at this hospital about how would you move a patient who weighs upwards of 350 pounds when your hospital loses power and you have no elevators and he's on the 7th floor. And so one particularly tragic death at this hospital I wrote about, Memorial Medical Center, was the 61-year-old man who was awake, alert, feeding himself breakfast that morning and asking his nurses about being rescued, when he would be rescued. Are we ready to rock and roll? And he died. He was, the staff could not figure out how they would get him down the stairs and then up to the helipad, and would a helicopter be able to take him? And he was one of the really tragic deaths. And there was an element of, patients were injected with drugs that arguably hastened their deaths. And so whole other story there. But so let's come to the example of Hurricane Harvey. Now, we've talked a lot about Houston, but in fact, the storm hit in the coastal area. That's where the big winds and the actual storm hitting happened. And I spoke with this EMS director. Sorry, she was a preparedness director with their coalitions. She was a chief person in one of the coalitions there. They have a really, like I mentioned, those emergency medical task forces. They also have a very organized coalition system there for healthcare preparedness. And so she was telling me that they had gotten some hospital preparedness funds, and was it hospital preparedness? They had gotten some federal funding. I'm not exactly sure which program it was, through the health department. And she had decided to buy bariatric setups for ambulances in her region. And she spread them out. And as the storm was heading in, she got those ambulances, and they had this whole other thing we didn't talk about was like sort of where are your vulnerable people in your population. So they knew where those people were, and they moved them out of the storm area before the storm. And she thinks it saved their lives.
Wow.
So that was pretty cool.
That's amazing.
Yeah.
That's great.
That actually is, usually people say, I'm going to tell something heartwarming, and you're like, whatever. But that was like legitimately heartwarming. All right. So I don't know how to sum. I mean, I think it sounds like we're working nobody except for the Dukes of Hazzards have achieved perfect preparedness. We're really the only people who've really reached that level.
So you'll let me, track that with the next hazard.
That's right.
Right. 5-piece New York Times article.
That's right. Just on how
the
amazing.
podcast really pushes.
Well, I think we need to tell these positive stories, actually.
That's right.
In fact, because that is the fact that sometimes things go right can be really motivating for all of us who care about preparedness. For all of you guys who are on the front lines, and I just want to shout out to you and your listeners who've devoted your professional lives to this. Sometimes things go right. Sometimes, and it's sad because it's hard for us journalists public health people will say, when we do our best job, nobody knows. It's just like, it's the crisis averted. It's the pandemic that gets headed off because the chickens are all killed, cold. It's not always so apparent or as dramatic when you have a success as it is when you have tragic deaths. So
no, I think that's exactly right. Like even the story about the hospital, deploying the flood logs and then staying high and dry, things like that I think emergency managers are always looking for ways to justify preparedness. And so hearing those positive stories that this place did this, it worked, can be good and can.
And one thing that I've learned just from doing this is, you are one of the journalists who really, you do write about drills and preparedness in your stories, and we read them, and they are so helpful.
You're the only ones. Sorry, I'm kidding.
and we see, here's an idea, and people are doing that and using it because it gets the word out there. And I do think we're seeing more positive stories because people are starting to build this base of knowledge. Sometimes I wish you had something like the National Transportation Safety Board does when you have airline disasters, and everybody is mandated to share their data so you can all learn from it. There's like a national standard. We don't have that yet. The best thing that we have are sort of national stories that people can sort of all learn from. So I think, the profession is grateful for coverage like that because it helps us learn.
But I also want to make a pitch for be transparent. If you do have the power, and I know a lot of people working in systems can't make that call, but for those who do, I feel like that is such a public service. And the other thing that I feel like I've learned over and over is the public is the first responder in a crisis. Like the official first responders, it takes a while to get there. You can't be there for everybody. And so the more you're able to kind of inform the public and usefully sort of marshal their desire to help each other, the better. And so think about that and think about stories that we can tell that in the media, that it's a challenge to tell, to find preparedness stories. Right. It's really,
and to make them interesting and captivating, that's hard.
And we are nothing if not transparent. I mean, a show that where you hear us opening our beers, we're like, we're probably a little too transparent. We're like, there's not even a window pane there. That's how transparent. There's like actually nothing there. Right. So
I'm not sure you're getting what I mean by transparency.
Mitch, put your shirt back on. You're being too vulnerable.
Oh man, we're only 2 beers in. So every guest that comes on our show, before we close, we like to subject to our lightning round, which is a series of very brief questions,
hard-hitting New York Times style.
That's right. Journalism.
This, like turning the microphone on me.
That's right.
This is brilliant.
So we're gonna go for that.
Yeah.
Right.
Yeah.
Okay. I'm gonna go first. You want to go second? You want to go first?
No, you go first.
No, really. Could you go?
I'll just go.
This
first.
is why the revolving door was invented, right? Because the inventor didn't like the thing where guys kept trying to offer the other one to go for. I'm just gonna ask the question.
Yeah.
So what's your favorite hazard? If you had to think about all the ways that destroy people, do you have a favorite?
No, that's sick.
We've been asking this question
zombies.
for so long now.
Zombies because they're not real and they don't actually kill people.
Okay,
that's right.
Yeah, that works.
Okay, that's fair.
Did you get the New York Times print or electronic version, or both?
Well, both, but we get that that's one of the perks of our employment. So we can walk in and pick up the paper.
Yeah, the real paper.
And we get digital subscriptions.
Can I just then ask a follow-up, which is Michael Barbero of The Daily like as beautiful as his voice sounds?
He is fantastic. Yes, and he's a very good dresser, and he sat in front of me for a little while before his in the run up to the elections, and then politics just took over the whole section, and all of us who were not in that moved out. But he was a pleasure to sit near. He's really funny. He's really just incredibly. He just maintains his cool even when he's working on a million stories.
He sounds like a snappy dresser. Actually, does he ever wear bow ties? He sounds like he might wear bow ties sometimes. Okay, we'll save that. We'll do an in-depth.
I was like,
check back.
3 questions.
You're right. I'm sorry. That was really less a lightning round.
Lightning round.
Sorry.
So, what hazard or disaster makes you the most nervous? Like, which one would you not want to go through?
Okay, I would say that I said to myself that was Ebola before the West Africa outbreak. So I remember.
But then you went there.
I remember saying to myself in earlier Ebola outbreaks, like, that's the one I would never go near.
Right.
And then, I spent 3 weeks chronicling the work of these brave doctors at an Ebola treatment unit. So,
so coming through that, did you still feel like that about Ebola, or?
Ebola is terrifying, but as we all learned, there's so much around it that hype around it that I think again, like, knowledge could be the antidote to fear, and we learned how it spread, how it's not spread. New York City learned a lot about that, and
all right, lightning.
Okay,
What's the first disaster that you remember when you were a kid?
Not necessarily that you worked, but just that you remember.
Yeah. Wow. We had tornadoes in Michigan, and I remember this little girl my age was killed in a town nearby, and like, one car lifted over the other car and it smashed down on her car, and that really was, I remember it vividly to this day.
Wow.
Yeah.
So what's the first disaster you worked?
It would have been the Kosovo. The refugees coming across into Macedonia.
Mm-hmm.
What's your favorite disaster movie?
I'm so busy writing about disasters, I never get to see movies.
It could be a documentary.
Titanic?
I
don't know.
That's a good one. No one's said
it is
before.
a massive hit.
Yeah,
sure. Major
It
Leonardo
might be the
DiCaprio's
only
career.
one I've seen. I like going to see
the only
movies
movie you've
not about disasters, because when
that
you
makes sense.
write
You're
about
working on
them
it
all
the time.
Yeah. Like in your downtime, you don't want to watch a movie about a horrible disaster.
Right. Also, you critique it. You're just watching it all the time, being like, there could have been better medical care in that situation.
So what's your favorite thing in your go bag, or like in your deployment bag when you're going to these faraway places? What's the one thing you always
definitely
have?
those like backup power cubes and things.
Mm-hmm.
Those are so important these days, but I'm trying to think if I have anything unique. Well, here's a twist on that. My twist is that when I interview emergency response folks, I often ask them about their go bags.
Oh.
How many of them do you think actually have them? I mean, it's shocking how this advice that gets dispensed is not always taken by the people who dispense it. It's kind of like the doctor who doesn't take his own medicine or her own medicine.
Yeah.
So
I feel like we've talked about that on here too. Emergency managers are the worst about making go bags or shelter in place bags.
And really, is it, I don't know. How useful is it?
Yeah, that's interesting.
Because it's the one thing that is sort of like, here's what you can do.
I think
go.
Well, I'm going to say, here's what I think. I think that actually shelter-in-place kits are more useful than go kits, because sheltering in place is a longer-term endeavor, and if you go, hopefully you're evacuating. The other problem that I have with them is I read this great paper about how go kits were inherently, there is like a discriminatory bias in it, because if you ask somebody to front a go kit, then you can assume they've got income and time to go and assemble that go kit, and so it came out of 50s. It came out of 50s middle class civil defense planning, and therefore it wasn't a strategy for those who are the most vulnerable sometimes that you have to go find. So I think there's a better thing than the go kit coming one day, and I'll just say all emergency managers are apparently waiting on that because they don't have their own go kits.
That's right.
I have mine though.
That's right.
Of course you do.
Well, I didn't used to. There's a famous story about me where when I met my wife.
Famous.
That's right, a famous.
World famous.
People
Everyone knows
all
about
over
it.
that. Every continent they're talking about.
You've
this.
heard of this, Sheri.
Yeah, it's mostly because people
we've
always
been writing a lot about it at
Yeah.
the New York Times.
Yeah. So when I married Jordan and I went to work on Hurricane Irene, she was like, "Where's my go bag?" And I was like, "Oh, yeah, I don't have one of those for you." And so I left her at home alone with some children with no go bag.
Mitch.
So later I bought her a go bag, and it was then so full it was too heavy, she couldn't carry it. So it's really the worst of both worlds.
I find them really useful for like going to report on disasters. I have one just because I often have to go. It's not like the disaster hitting home. It's useful if you have a job that requires you to go to disasters.
Yeah.
That's when the go bag. But we shouldn't, make light of this. It's important, but it's important to look critically at things that we just assume, right? And but have you told the listeners about your mapping for location?
No, I didn't. You mean how I found my house?
I mean, I love that story. I think it's really interesting.
Sure.
I mean, if you feel comfortable telling it.
Yeah, why not? Everybody should do this. So
I think the journalist should ask the last question.
well, Sheri, let me tell
Talk
you.
about turning the tables.
Oh my God. Well, when I was moving to New York City from Florida, I was like, where am I going to live? And I'm a contingency planner, and I'm really worried about everything all the time. And I was like, well, clearly Manhattan is going to get
Sheri, bad timing.
That was bubbly water.
It's rude.
I was like, well, clearly New York City is going to be destroyed by any one of a number of major disasters. How do I avoid that? And so what I did was I got out my GIS software and I laid down a series of threat maps over New York City where I looked at coastal storm flood zones. I looked at various sort of critical infrastructure explosion sites, and then I overlaid that with my best nuclear cloud analyses of where the cloud was going to go, and I drew a series of circles.
Where the dirty bomb would be set off.
That's right. That's right. Well, from a couple of different threat scenarios with it, and I knew, just to be clear for the listeners, both for dirty bombs which spread radioactive materials, and also
Indian
nuclear devices that were actually kiloton-based nuclear devices.
We have those in New York City?
Well, there's one of the threat scenarios that you're worried about nationally is a suitcase-sized improvised nuclear devices.
Okay. Yes.
And so anyway,
did you look at an Indian Point too? We have like a nuclear power plant that.
Yeah, I did. Although I was but it turned. Yeah, we could do a whole show about Indian Point and the dispersal patterns of radiologic outflow from and how they get messed up by the Hudson. Luckily, when they come down, the Hudson weather patterns actually really screw with them, and it goes all over the place. Whole other story. Anyway, of course I needed to add good school districts, and then when I did that, I decided on my current neighborhood, doing all that mapping, and I've been living here for like 10 years now, and it's worked out.
And
okay
no
so
nuclear
far.
bombs.
Famous
good.
last.
knock
on wood.
Sheri,
But I love that story. It's like that. We should all.
That's how paranoid I am. Thank you
True
so
New
much,
Yorker.
Sheri, for
That's
being.
how much you believe in your work.
That's right.
It affects every aspect.
You should move, man. I'm just telling
I
you.
definitely am in
one of these days,
10
you're going to get
kiloton
sucked
range.
up by a fireball,
Seriously.
and it'll be your own fault.
That's right. I didn't plan.
Thank you so much for coming on
Thank
tonight.
you, and thanks to all the listeners, especially those who are doing, fighting the fight every day.
Doing God's work.
That's right. That's
Well,
right.
how do people, if they want to follow your work, how do they follow you?
Thanks for asking. Wow. So I guess they could go to my website. That's an
That is like
old
so
thing.
90s.
Nice.
Oh my God.
Hey,
And
we have a
it's
website too.
SheriFink.net, N-E-T, not
SheriFink.net.
SheriFink.
And is that because SheriFink.com
No,
was
please.
taken?
Let's not go there.
Okay.
Talk about disasters. Or Twitter, Sheri Fink, SheriFink, or on the New York Times.
Now, can you tell us about any upcoming stories you're working on, or is that all classified? Is there what's the next disaster?
I still have some hurricane stories from the last season.
Oh, nice.
And now that the new season is upon us, I really have to finish those. So I'll keep you posted.
Great.
Thank you.
Awesome.
We'll call for follow-ups. We'll be like,
Okay.
a year from now, we'll be like, Sheri, what?
Sherry, have you published any stories?
Yeah,
That's
I haven't
right.
seen
That's
your
right.
Twitter feed active in a while.
Okay, wow. That was
fun.
great. Yeah,
we keep upping the bar on these podcasts.
That's right. Basically, we need to interview Jesus Christ now.
Yeah.
That's going to be what we're going to... Because, that dude's seen the greatest disasters of all time throughout history.
That's true. He definitely has. I mean, on a scale to 1 to Pulitzer-prize, where do you think this ranks in her career?
Maybe like a People's Choice Award?
Yeah.
Something like that,
Yeah, Teen Choice Award,
I don't want to say a Grammy. Maybe like
Not
a
a Grammy,
Nickelodeon's award. What are those things called?
Yeah, where she gets slimed
Yeah.
when she accepts the award. That's probably...
That's right.
But that was great. Oh,
we have Gil the sick
Gil's
baby
up
is
way
with
too
us.
late.
I know.
It's got a cold.
Everybody say a good word
Bless
for Gil
you.
the sick baby.
Bless you, Gil.
Bless you, Gil.
Well, so if you want to follow us, Hazards Podcast is our Twitter handle. If you want to call us, you can call and ask us a question. Tell us a topic to talk about. The number is 859-429-2731. We'll read your question on air, or maybe even play it on air if we can figure out how to do that technologically.
That's right. We've got that down. Gil's got a question for us, I can
Gil,
tell.
what's your question?
Yep,
Hard-hitting
Gil,
question.
Gil, what is
Go.
it? What is it? Oh, yeah. No, that's a good one. That's
What
very
is
smart. We're
the
going to cover
purpose
that
of-
next episode.
Yeah. Great.
But thanks, everybody,
Thanks for
so
listening.
much for tuning in, and we will come at you next time.
Later.